Hello friends, Sarah here from the Centre for Mental Health. I hope all is well. I just thought I'd just send a little hello out to you and acknowledge the extraordinary time that we're in at the minute. We know that a lot of people out there are incredibly worried about the virus right now. I'm worried, I'm a human being. I think it's worrying if you have somebody in your life who's vulnerable. There's all sorts of reasons why you might be worried. And all of that is perfectly reasonable in terms of the kind of stuff that's going on. So it's a kind of real, tangible worry that's okay. The thing that we must remember during this time is obviously our mental health is incredibly important. And whilst we prioritise our physical health and washing hands and taking ourselves into isolation, which is absolutely right, we mustn't forget that our mental health will also help us get through this. And so as we await the mental health guidance that will come from the government, which we know will be really helpful for so many people, we just kind of want to reinforce why it's important. And it's important because it often can be the thing that helps you recover more quickly. So if your mental health is poor, recovery can be challenging, more challenging than it would have been. So there's something for those people who do not have a mental health problem right now, but, you know, mood might be challenged, all of those things, anxiety might be raised, all of those things may happen. And so there's something about you understanding that, putting the things in place that will help you get through, staying in touch with people that you care about, doing the things that make you feel better. I think all of those things will make a difference. But there are also those people who have mental illness now. And it's for those people that we at the Centre for Mental Health are incredibly thoughtful of. And we know that mental health teams all around the country are working with their patients to make sure that there are care plans in place. There are, things happening in relation to medication, things happening in terms of, how people receive visits, etc. So there's something about remembering that those people that are vulnerable are not just older people or people with underlying physical conditions, but there are those people with mental illness that are also vulnerable. And so it's a plea to remember those people too and make sure that we as communities, as a society, are holding them in mind and making sure they're on the list when we're thinking about who do we need to support? Who do we need to think about when we're making our own plans? Maybe when you're, on your streets, is there somebody who you just might want to check in on? So I'm not going to preempt the guidance that's going to come out because I think it's really important that we have very clear information. But I guess this is just a message to say we at the Centre for Mental Health are thinking of the nation's mental health. We continue to do the work that we always do. So whilst we had to cancel a couple of events this week, we are still working and we're still advocating for equality. We are still working with government and others to make sure that the mental health of the nation is on track. And so do reach out to us and tell us how you are. If you've got some information about interesting things that people with mental illness can do or things that might support people, share it. Do let people know. All of this does really help. And I guess lastly, there's something about making sure that, we remember we will get through this. This is probably going to be a very difficult 6 months. But you know what? There is always a silver lining, and my chair, Dame Sue Bailey, has been holding that line very strongly over the last week. And I think that whilst life might not be quite the same, some things might even be better. But let's all stay safe and do stay in touch with us, and we will keep in touch with you. We're going to do some videos about various things over the next couple of weeks, so that might keep you interested. And our publications will still be coming out, so stay in touch with us and take care. See you soon.